Hello, I'm Dr. Daniel Farkas, and I'm here to talk to you today about skin conditions and an all-natural approach to healing. Again, I'm Dr. Daniel Farkas, DC CFMP. I am a certified functional medicine practitioner practicing in Troy, Michigan. Now, skin conditions and the all-natural approach to healing. I'm so glad you're here to learn today. Just understand that regarding the prevalence of skin conditions and skin problems, 1 in 4 Americans, 84.5 million people at the time of this recording, are impacted by skin diseases. Skin diseases range from common conditions like acne and eczema to more serious issues like skin cancer. Now, just some of the prevalent skin conditions that I see are acne, eczema, psoriasis, which is actually an autoimmune condition, fungal bacterial infections, hormonal acne, and very commonly infant skin problems, drug reactions from use of pharmaceuticals and other dermatologic interventions, and of course allergies. So the big question always is, what is the cause? Everybody wants to know what is the cause and how can we get to the foundation of the problem. So some possible causes are this: hormone imbalances, such as issues with estrogen or testosterone metabolism. Stress plays a huge part. This can result in blotches and other types of skin conditions. As I mentioned before, psoriasis is an autoimmune condition, and this can cause scaling of the skin. Other possible causes are fungal and bacterial infections. Now, those can be on the surface of the skin or actually even throughout the entire body. Now, infant skin conditions can come from numerous places, sometimes from birth difficulty, but this is often a reflection of their undeveloped immunity. Infants born by cesarean section and infants that are not able to be breastfed, they are at greater risk for skin conditions developing. Now, drug reactions. Drugs are, in essence, toxic substances that can cause bad skin reactions. And of course, allergies. Allergies are the response of our immune system to exposure to irritants. But what about the gut-skin connection? You might be familiar with that, you might be not. I just wanted to throw that out there and plant this seed of this question in your mind, and we'll be coming right back to this. So big picture, here's the problem. The ordinary approach to addressing skin conditions. It's what I call the unnatural outside-in approach that could consist of the use of steroids, which there is a time and place for steroids, as with all medications. But the steroids, of course, just artificially break up the inflammatory cycle, but they don't get to the root cause of the problem. Everybody is aware of that. Now, antibiotics. These, unfortunately, though they are necessary sometimes to kill infections, fungal infections, bacterial infections, and more, unfortunately, these have side effects where they disrupt our normal healthy bacteria and fungus, and that can lead to further problems. And then, of course, I'd say one of the most common things is just the masking of the symptoms. We can use things like cosmetics in order to cover these things up, but those have side effects too as well, and none of these essentially get to the root cause of the problem and bring things back into balance. So all this can leave you with a sense of uncertainty and just not knowing exactly what to do. You feel like you have to do something, you should do something, especially if it's for your child. You have to be responsible, but we just don't know what to do, and we don't want to make things worse. And when we do something and things get worse, then we get even more uncertain. Very difficult. So here's the good news. The natural solution, I feel, in my experience and opinion, is to look within instead of the outside-in approach. Look within. So the natural approach starts with this. I always say, don't guess, do a test. I utilize and benefit from advanced testing that you won't find in ordinary medical settings. I utilize advanced gut and stool testing to take an honest look inside the gut to see what's happening and see how it might influence the skin. And there are two big reasons why. Number one, the inside lining of the intestines, that is ground zero, where all things good and bad enter the bloodstream. This could be a point of entry for obnoxious things that trigger the immune system, bother the brain, and cause a terrible skin reaction. Now, in addition, it's very common knowledge that trillions of bacteria inhabit our gut. But please understand something special. Those bacteria and fungus, they communicate directly with the brain and the immune system through the chemicals they secrete that enter the bloodstream, as well as they communicate with the brain and immune system along the course of a nerve called the vagus nerve, V-A-G-U-S. You may have heard of that. The vagus nerve is the gut-brain connection and plays a huge role in inflammation and skin conditions. Now, I also like to have myself and my clients benefit from food sensitivity testing. These are a little bit different than allergies, though they affect the body in a negative way. Now, food sensitivities we're finding out come about when, just as I mentioned, that inside protective lining of the intestines breaks down. It can create sensitivity and immune responses to even clean, healthy, organic, and expensive foods. Testing is a must so that we can know with certainty what foods to temporarily remove from the diet while we get the gut in order. And this doesn't take long. Now, there are advanced hormone assessments available that don't just measure the levels of hormones that may be in your blood, but that actually measure how your body metabolizes them. And that means to put the hormones together, but most importantly, to break them down after they're used up. And it's in this stage where many people develop problems with metabolizing out estrogen. This can result in acne on the cheeks. If someone has a problem metabolizing out testosterone, that could result in cystic acne along the jawline, the back of the arms, the neck, and cysts anywhere throughout the body. Advanced hormone assessments are brilliant. And finally, toxin and mold testing. Understand that mold, though it's all around us, it can accumulate in the body, especially when we're exposed intensely, as well as toxins. In this modern environment, we're exposed to many unnatural toxins. These things can negatively affect how our body processes these out of our system, and it can result in skin conditions. The good news is there is testing available for all of this. Now, what does natural support look like? Once that we have test results and we know who the enemy is, what type of specific support is available? And right off the bat, for those who present with what we call that leaky gut, that breakdown in the lining of the intestines I mentioned, that needs to be repaired right away using natural support, just like you need to repair holes in a boat. When the food sensitivities are identified, I typically instruct people to avoid those foods for anywhere from 60 to 120 or even sometimes 180 days or more, so that they don't have that negative immune response. But it's the testing that determines which foods to avoid. Now, hormone metabolism support, this can move in different directions. Sometimes the hormones are too high and they need help just being processed down and processed out of the body. Sometimes they're very low and the body needs help and support to boost up normal production. This can all be done with natural support. And then finally, detoxification of mold and toxins. This is done very carefully when the client is ready, when their body is in a strong, more foundationally sound base. Then we can start the detoxification process to safely get the toxins bound up and removed from the body in order to help the skin. Now, bringing the gut bacteria back into balance is crucial, as I mentioned. Bacteria communicate directly with the brain and immune system, and they have powerful influence over how the brain and immune system perform, especially when it pertains to the skin, and this is done naturally. Immune support along the way is important. Things like vitamin D and fish oil, quercetin, and more, they are crucial to give the immune system what it needs to restore order. Now, of course, stress plays a huge role for many people when it comes to their skin. Stress negatively affects the immune system. Providing all natural stress support is important for many, many people so they recover from their skin conditions. And of course, crucial diet guidance, major do's and major don'ts when it comes to the diet can have huge, huge impact on the skin. So it all comes down to certainty and knowing what to do and having that feeling of that peace of mind of knowing that we're not doing something harmful and that we're helping to support naturally from the inside out. It's that certainty that brings peace of mind and can help you sleep like a baby. Or if you happen to be watching this and you have a baby who's struggling with skin conditions, who can't sleep, who's itching all night, or if you're an adult who can't sleep, who's itching all night, you know what I'm talking about. The feeling of certainty of knowing that you're getting your skin back on track can be a great place to be, and it's possible to maintain. Thank you for watching. I'm Dr. Daniel Farkas, and if you haven't done so already, you are welcome to contact us and learn more at Back to Health Natural Solutions, and even set a time to talk to one of our staff or specially trained doctors to see how we might help you.